Dr. Bill Adams here. This is No Spin Live. And do we have a show for you today? We're going to talk about the biggest item of confusion for patients. What does board certification actually mean? And we've got three incredible plastic surgeons to discuss it. We have Dr. Jason Posner from Boca Raton, Florida. Jason, how are you?
I am good, Bill, with my new No Spin Live background.
It looks excellent.
Thank you, BJ.
Dr. John Cook from Chicago, Illinois, and then my neighbor just a little bit south of Dallas and Houston, Dr. Christy Hustad.
So I'm a little bit jealous. How come Jason got the fancy background? Like, do you have to do this for so many years to like get the backgrounds or something?
BJ likes Jason
favoritism.
BJ didn't like my beach with the martini, so he made me change it out.
Okay, fair enough.
So what's the COVID report for you guys? So Jason, what's the report in Florida?
You know, it's around. We're being careful. We now have antigen and antibody testing in the office. So interesting thing the other day. I had a case scheduled for yesterday. It was just Friday, and she calls us up on Friday saying I don't feel good, and she was COVID positive, so we canceled her. I saw the existing patient wanted a little lipo. We came in. She was squeezing into the spot for Monday. We COVID tested her in the office. She turned out positive. So we canceled her. We actually were able to find someone else popped in. So it's around, and both of these patients one was asymptomatic who came in, who I was going to slip in that spot. So it's around. We got to be careful.
John, how about Chicago?
Yeah, I think we're being pretty careful. The surgery center that I use has a really good protocol. So, they take care of that. In office cases where, being a little, I don't do the formal testing at this point for those things under local. Is everybody like, when you get people coming into your spa, etc., are you testing them?
No.
We're not doing injectables, but we're doing local procedures in the OR.
Yeah.
We actually, our surgery center adopted the policy originally, back in April, and we actually published that experience, but we don't routinely test any patients. We screen them, we take temperatures. We'll test based on risk factors, people that are higher risk, we'll test, we've done over 5,000 cases now with no issues. So it's actually worked well for us. Christy, what do you think?
Yeah.
The vaccine's coming out.
Yeah, sign me up. I know there's a lot of hesitancy. And even we've pulled our surgical center, and there's like a big kind of almost consensus bias there. Everybody, I think, everybody will get it, but that's not the case. There's tons of people that are really afraid of this, but I'm sign me up. I'm ready to, be done with this. So
maybe actually, I think it'd be bad. I think you should get the vaccine on TV with it was Clinton and Bush.
Oh,
and
yeah,
Obama.
yeah, absolutely. Yeah, I think
Clinton,
Jason
Bush,
was talking about that.
Obama,
Sign me up.
Hustad.
Yeah, right. Yeah. Has a nice ring to it,
It'll be good. All right, well, let's get on this topic. Jason, you sent me this. I'm going to have you lead it off, but this is a question that so many patients have problems with, and it's confusing to many people. It was actually on Real Self. It said lipo is not considered plastic surgery or reconstructive surgery because basically this person, I guess, had a BBL, Brazilian butt lift, and they said that their doctor was only board certified in cosmetic surgery. So what's the story, Jason?
In this particular case, it was concerning an OBGYN who was doing liposuction and fat grafting to a patient. And the person was a Real Self question, and the person wanted to know, well, what does this mean? Well, how come she's doesn't have a board certification in liposuction? So, it was sort of an age-old question. We've probably addressed this 50 times on No Spin, but it was relevant because this came up, a couple of days ago. And the thing is, we've all been in this game for so long, it's nothing for us. It's like, what's the difference between a cosmetic surgeon and a plastic surgeon? It's like, did you brush your teeth today? I mean, we know this stuff cold, but for many patients out there, it's a very confusing because people are trying to pull the wool over your eyes. I mean, we all on this call go through a very rigorous program of training and testing to be able to say that we are board certified in plastic surgery. There are other specialties that do a little bit. The confusing one to me is cosmetic surgery because there is a board that is not ACGME certified. And some of those people are pretty well trained. They've done a lot of surgeries and they might be very good, but it's hard to tell based upon certification alone with those doctors whether they're good or not. You know that if you're operated on by a board certified plastic surgeon, they hit a certain amount of requisite training. And even then, there are some surgeons that I probably wouldn't let cut my dog's toenails.
Yeah, well, I mean, John, like that, it is true that some people have had surgical training, but it's also true that a lot of these people have zero surgical training. Mm-hmm. There's some people that go to a weekend course and they talk about how to do this surgery over a weekend, whereas like what you all have done and I did and people that are board certified by the American Board of Plastic Surgery, we undergo medical school and then 7 years of residency and general surgery training, and it's a long time, and even after all that you still are learning. So I mean, Bill, are you the same surgeon you were 20 years ago? I mean, we've only been in the game. Yeah.
We're not, John. I mean, Christy's younger than us, but like I learn all the time. I learn from you guys. Absolutely. I went and visited Bill 6-8 months ago when we spent time in the OR because I wanted to learn about quick recovery breast dogs, and we all learn from each other. And if you're too pig-headed to learn, you shouldn't be in this business.
But John,
that's what makes it fun. Yeah. Absolutely, yeah.
John, what do you think? I mean, I think it is a problem because it's a little bit, it's a little bit like American Airlines doesn't hire drone pilots to fly their jets, and it's the same thing. Like operating in people is serious business, and it requires a lot of training, right?
Well, absolutely. And you have a situation where I think with social media now, it's really confusing people because it's very, very easy to put on a mask with social media and pretend to be something you really aren't. But if you get someone who's certified by the American Board of Plastic Surgery, they have a certain commitment. They used to talk about 10,000 hours, a lot of these books for, whether you're going to be a serious musician or an athlete or whatever. Yeah. And, that's a lot different from taking a weekend course, getting a little certificate that you can stick on your wall and saying, look at me, I'm certified. So it all comes down to, looking at the American Board of Medical Specialties, which are the recognized boards. And there you have the American Board of Plastic Surgery. But of course, a lot of people are confused.
Ask Christy, you're going to go fly a plane for American. Are they going to put you in the left seat right away?
Right. Yeah. I mean, it's ridiculous. Yeah. And it's just this game of hijacking nomenclature, right? There's power in verbiage. And that's the new marketing game, right? We've done so good at saying, make sure it's a board certified plastic surgeon. Well, now everybody's shifted that. Okay, I'm board certified. They go on to that. So now everybody says board certified, and almost never do they put in whatever they're board certified. Oh, I'm board certified dermatologist doing surgery, or, board certified family medicine doctor doing surgery, because they're not trained in surgery. And there's a little bit, and people don't know the difference, so they just say, oh no, they're board certified, but in what? So that's the newest thing that we're really pushing is in what are you board certified? Obviously, we all know the cosmetics, that's a made up board. That's why it's not recognized. They don't have the vetted, strenuous training, on their subjects that they're certifying. So there's something to that too. And it comes down to safety, right? The absence of data doesn't mean there's no complications. We study ourselves a lot. That's the whole tenet of plastic surgery is safety. And we study that and we report. And like you said, we're learning, we're constantly doing all that. That's not the case with a lot of these other doctors that are touting themselves. And so we're continually evolving and making sure that our patients are taken care of in the best possible way. That's what that board certification means.
And Christy, because it's tough for patients to figure out how do they vet that, or how do they try to verify that their doctor actually has the training? What do you tell your patients, or what do you tell somebody that asks you that?
That ask them board certified in what? I think that's the important thing, because in plastic surgery, at least that they've had, like Dr. Posner was saying, the prerequisite training. And so that's the main thing I tell them. Ask for lots of before and afters. I remember a gal coming in for liposuction, because that's low-lying fruit, right? Everybody thinks, oh, it's so easy. We all know that there are lots of complications that can happen from bread and butter liposuction. It's not straightforward in a lot of instances. So board certified in what? Ask to see a lot of before and afters. And I think that's a good starting point, at least.
And Jason, you had the perception sometimes becomes reality with some of these cosmetic surgeons, because their offices are fancy, they got fancy websites, and there's a lot of wording like Christy's talking about. They're board certified various things. So it can be really tough. And it's kind of like Jason, I'm always asking Jason about his Ferrari. He's got new Ferrari here, but just because you have a Ferrari, you've had a bunch of Ferraris, Jason, but they're not going to let you drive in Formula One, right?
No, not at all. Just like they're not letting me on a plane up front.
Yeah.
It takes a long time to become a professional driver. Like, do you want me delivering your baby? Maybe I did one in med school 30-something years ago. We did some, but you got to be doing this. There are people who do the work every single day. We're always in the operating room. I talk to Bill in the OR. Where are you? In the OR. I'm coming out of the OR. We're seeing patients. We spend our time operating. We don't spend our time sitting on the computer. We're busy. That's why we do these calls at night, because we're all been in surgery all day or seeing patients all day. It's that I really am a big believer in that 10,000 hours that John was talking about.
Absolutely.
We've always heard this adage, like you hear these professors, do you want the professor who does one heart transplant a year doing your heart transplant, or you want the guy who's in the operating room every single day doing heart transplants doing that on you? I want the guy who's been doing it, a woman who's been doing it all day long.
Yeah, no doubt.
Absolutely.
Jason, when I was at Parkland in my training, what we're talking about, we delivered people are having babies all over the place at Parkland. We delivered a baby successfully in the elevator, and then in between the ER and the parking lot. So I'm 2 for 2.
That's good.
So if somebody wants to have a baby, they might want to bet on me because I've done it. Well, John, you're going to have the last word here. What do we want to leave our viewers with?
Well, I think the key thing is to really do your homework, and things are not always as they seem. So you have to be really careful and look to see where they're certified. Certainly, it's not just the technique either. Because one of the things in our training, we've all come through extensive training. It's not just the technique of the operation, but it's understanding surgical physiology and anatomy. Some of the things that we've heard about where you have lesser trained people or untrained people really getting into trouble, it's not always a matter of technique, but it's a fact they don't understand the seriousness of the physiology, especially if you're doing something like a large volume liposuction that can have really serious consequences for somebody. Or they don't understand that someone might have an abdominal wall hernia. If you go in there and do a liposuction, you could be having that poor patient end up in the operating room with a bowel resection. So there's a lot more to it than just the procedure itself.
Chrissy, you had something you were going to say?
I was just going to say, we had a gal call over from a local med spa the other day, freaking out end of the day, asking for help. She was doing liposuction alone in her facility, didn't understand that there's a certain amount of tumescent solution that's allowed. So the patient was getting lidocaine toxicity, was calling us for help. We luckily had lipid emulsion, sent it over, transferred, called the ambulance. But she says, I don't understand. You guys do liposuction all the time. How's that different? She had no idea about concentrations of tumescence and what that means compared to standard local. I mean, it was just so simple, that's just ingrained in us. And so it's simple when it's not,
Yeah, that's amazing. Well, and one thing, if anybody, we've offered this before, but if there's a viewer out there or a patient that's having problems with this, we are more than happy at the Plastic Surgery Channel to help you vet whoever you want to go to. Just email info@theplasticsurgerychannel.com. There's contact lists at the website. You can reach us through social media, but we're happy to help. Any patient that needs that assistance with figuring out who the right person is to do their surgery. So, well, listen, that's been awesome stuff. Thanks so much to our 3 experts. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.